All right. Good morning, everyone. I'm Dr. Disha Shah. I'm a child psychologist and special educator and founder of Devruti. It gives me immense pleasure to invite Ms. Disha Rao. She has a master's and bachelor's in speech language pathology from Nair Hospital, Mumbai. She's also advanced trained in oral placement therapy level 1 and level 2. She has immense experience and knowledge, and she has worked with renowned hospitals in Mumbai like Kokilaben Ambani Hospital and SRCC Hospital, along with her private practice. So she has collectively a lot of experience working with children and adult population. At present, she is in Canada. She is registered as a speech and language pathologist. Sorry, in registry of speech
Autism
autism
service providers.
service
Yeah.
provider. Yeah, sorry, in British Columbia. So we welcome you, Ms. Disha. Um,
Thank you so much, Mr. Shah.
Thank you. Now we all know that speech plays a very important role in today's life when it comes to language, communication. We all want best for our children. But I personally feel that the root lies when the child is young, and if the child develops a proper speech, his language will be better, and then his communication style will be better, and then he'll be able to cope up better in school life, career, college, and professional life. So we have invited Ms. Disha to share all her knowledge, all her expertise and experience for all our parents and viewers so that they know and they understand how to apply them. So I'm going to ask few questions to Ms. Disha, and post that if you have any questions, or you can put it in the chat box and she'll be happy to answer. All right. So Ms. Disha, my first question to you is, um, how important is speech development, and what are the important areas that you according to you should focus in this topic, in 3 months, in the age of 3 months baby, what what aspect has important?
So, hi everybody. So, yeah, so as we all know, that speech is very important because it helps us communicate our wants, needs, and it helps a child to request for whatever he want. If he's frustrated, he can express. If he's enjoying something, he can express via words or maybe with gestures. So, speech is really important. And there are quite a few important areas for the speech development that I'm going to talk about today. The first one is communication. In that, so communication has receptive and expressive language. Now, receptive language is how much a child is understanding, and expressive language is how much the child is able to express. Now, expression can be with words and without words as well. With words, as we say, verbal communication. Without words, if at all a child has difficulty in expressing words, the child will use gestures to communicate. We still call it communication. So so basically, the most important area is communication, wherein if we go to 0 to like 3 month old infant, there are variety of ways an infant communicates. Like if you talk to the infant will smile at you, giggle, will remove cooing sound, gurgling sound, vocalize something. The infant will also look for you. They will search you when you're talking to the infant. So that is how they communicate. Um, Also, they start understanding who is the familiar person to them. Like, for example, if they know, for example, I'm the mother of infant, for example. So the child will know my voice. The child will also know father's voice, grandparents' voice, whoever is there in the family. But the child wouldn't know or wouldn't recognize the sound, the voice of not familiar people, like strangers maybe. So that's communication. So that's important part. Second one is sensory. Sensory is mainly how the child is able to tolerate different types of movements like rocking, hugging them, cuddling them, moving, bouncing, all these kind of movements. Also, they get used to variety of textures, sounds, variety of what do you say, touch and feel. Mainly sensory is. So that is also an important part of communication. Next one is imitation.
Mm-hmm.
So I would say speech development is kind of imitation and speech development goes hand in hand, I would say. So the first thing starts is the gross motor imitation. So like the child starts copying like actions, some sounds, that is fine motor imitation. So that is also one of the important area of speech development. There is one more, that is feeding, I would say. So the child starts like breastfeeding is happening, the child shows sucking reflex, sucking movement, tongue movement. So these are all the initial stages of the speech development, so this is also very important.
Mm-hmm.
And play and social skills. So playing means the child starts exploring with toys. They learn problem solving skills, object permanence. So object permanence is a term which it's like if I just hide a toy in front of the child and the
Yeah.
child starts looking for it. This also happens in a 3-month-old infant. If you show an infant a toy in front of him, like the infant is lying down on the floor, and if you show a toy to him and if it just goes away, the infant will start crying for it
Mm-hmm.
because he wants the toy, or he will like keep on searching the toy, like he
Okay.
will actually keep on looking for the toy. So these are various important areas of speech development which I would say that all the parents can focus on and plan activities, talk to the child in this way.
Okay. So thank you for this elaborative answer. So my next question is, what step as a parents I can take so that I can make my child's speech development better as he grows up.
So I first thing I would say is there is nothing like a child has to learn at this stage. Like he or she should know. Like the child should know crawling at like 5 months. If the child is not crawling at 5 months, it is late. No, it's not like that. A child develops all the different milestones at their own pace, and it can be a little different. Of course, we should know what is within the normal range and outside the normal range. So that is one thing. Now, the steps that I would say, these are one of the few steps that the parents can start, working on with a child. So first thing is everybody in the house should, interact with the child. Interaction is very important. Interaction is going to open doors of communication for the infant mainly. So everybody, whoever is there in the house, who are familiar and in the close environment, they should interact with the child, and this will make the child understand like people, who is who in the house and who is a stranger. This will help them to differentiate between a family and a stranger. These
Mm-hmm.
are also like, if we talk like later on, we will understand that these are also kind of safety things that we should make the child understand. They will start understanding at right when they are born.
Mm-hmm.
So that is first thing. Second thing is give them variety of situations where they can explore themselves. They can play with different kinds of toys. Now, when I said different kind of toys, doesn't mean that you have to buy all the expensive Fisher Price toys. No, we don't have to buy expensive toys. It's just like, for example, if you have a pillow, you can just play peekaboo with a child. Like, it's like peekaboo. You just play with a child. That's it.
Mm-hmm.
For example, if we have some animals, so we can actually draw a farm, or we can actually draw like colorful things on the paper and show the child, and then actually get the pig and make the pig sounds, cow sounds.
Mm-hmm.
So starting with lots of animal sounds, vehicle sounds, a lot of variety of speech sounds, like we say, for like the early sounds are like, for if for example if the child wants to go out, so we say baba, or go go, we say that. For mama, papa, or for eat, we say mamam. So we can start initiating these kind of what do you say, you give them more language stimulation like this, so we give them more chances to communicate. There is one more thing is, after opening the doors of communication, like I think all the parents these days, they do it,
Yeah.
to not introduce screen time as much as possible, because
Yeah.
that might hamper the child's development, I would say. Also, when they are infant, like every culture, every I think every religion has a different way of starting the feeding of the child. Like in some caste and in some religion, they start at 6 months, some start at 5 months. So it's all different. But always start with a variety of consistency of food and different textures of food. So if you don't give screen time to the child, and you give them, like, expose them with a variety of food textures, they're going to be very flexible, and you're going to enjoy the diversity of food items, and this is going to help them basically.
Absolutely.
Next is you're going to give them, like, they can explore with a variety of textures as well. Now in textures we can start with soap. For example, he's taking bath. Like some kids, they cry. Even I used to cry when I was a kid, when my mom used to give me a head bath. But it's okay. You still normalize it, desensitize it, like you do it more and more. Not because if the child starts crying, don't just stop it. Oh, then let's not do this. No, just do it casually, slowly, bathing the child, brushing their hair, making them sit in variety of places like a couch or the floor or anywhere, because sometimes kids, they're comfortable sitting only at on the floor, or they are comfortable sitting only on a soft satin couch. Not like that. We have to make them explore all varieties of situations,
Situations.
and that is going to help them in future for their speech development as well.
So, Miss Disha, from your answer, all I understand is just play with the child as much as you can. Give him more time. Like whatever you can do, just do
Yes,
it. Yeah, and make
yes,
yourself a kid with the child, and the child will develop. Right. Uh,
yes, yes.
okay. So that's again lead ask me and give me an idea to ask you this question: how will I know that my child is listening because he's too young? So how will I know that my child is listening what why I'm saying or what I'm doing?
Right, right. So I'm a speech language pathologist as well as an audiologist, and we
Mm-hmm.
are trained in evaluating hearing of even infants and NICU babies.
Mm-hmm.
So we have done hearing testing of babies as young as 2 days old, or 1 day old, or few hours old as well.
Mm-hmm.
So this is basically like the testing is called as behavioral observation audiometry. It's called
Mm-hmm.
as BOA.
Mm.
Now, I'm just saying the term so that parents know what is it
Oh,
exactly.
okay.
So anytime if they want to go and get the child tested, they don't know the hearing test name or something like that. They can just say like behavior observation audiometry. It's called BOA.
Okay.
So what? Yeah. So the meaning of this is we actually assess the behavior of the child during the hearing testing. So this can be done anywhere. This can be done at home. This is basically to rule out if the child has a hearing loss or no. This doesn't say that the child has like like what do you say, severe degree of hearing loss or
Mm.
mild hearing loss. This is just to rule out if the child has good, like does a child, can the child hear or he has any difficulty. So there are a few things that we can focus on. The first thing is, for example, if the child is sleeping, like the child is in a light sleep, not deep sleep, if you make some sounds like a clapping sound or a banging sound from a distance, of course, because he's 3 month old, right? He or she
Mm-hmm.
is 3 month old, so
Yeah.
we don't want to scare the child. So we're going to check with different variety of sounds like banging sound, clapping sound. We can also make some speech sounds like vowels, that is e, u, then s, sh. These are different types of sounds. You can actually just say those, make those sounds in front of the baby, like maybe on the left side or the right side. And if you see any change in breathing pattern, you see fast breathing pattern, the child might start breathing fast. Next is the child might wake up a little bit. You will see some movements, some finger movements or some feet movements. Then, for example, if you call out the child's name, the child will immediately wake up. Now, this is during the sleep. Now, next is when the child is awake. You can check is you call out the child's name. The child might search for someone who called out his name. The child might not know that's his name, but he might start searching. Second is if the child is crying. So, if the child is crying and suddenly you call out the name and the child stops crying and starts looking everywhere, that means he heard you're calling the child. That means the child heard it. Then next is startle. Startle is if you make a loud sound and the child is like startling, that
Mm-hmm.
means okay, that's okay, he's hearing. So
Okay.
these are different ways of checking if the child is hearing or no. but like further testing and everything, like if you feel, oh, the child is not responding, again, this all depends on variety of environmental factors also. Like if the environment is very noisy and if there are lots of people talking in the house and if you're testing all these things and if the child doesn't respond, you can't say the child has hearing or
Yeah,
doesn't have hearing. So
yeah,
you can't do that. But this is just a very, just a way to rule out.
okay.
So this can be done with the parents. Parents can do it. And if they feel that child is not responding or not searching for the sound or not looking, looking for it, just go to an ENT or an audiologist and get the child tested.
So thank you, Disha. This simple steps to check at home whether my child is hearing or listening properly or not, really makes parents be vigilant about it, and that's how they can take steps. So those simple steps are really useful. Which also lead me to the next question is, if I have to do alternative ways of teaching my child to develop speech, or maybe for communication purpose, could you if can give some steps or suggestions where parents can do that?
Yeah.
Oh,
So there are lots of ways, I would say. Again, the first way is playing with the child, interacting with the child, no screen time. These are the most important rules.
hmm,
The next is you play music with the child. You sing some rhymes with the child, like Wheels of the Bus, Twinkle Twinkle Little Star, Johnny Johnny, any different rhyme. Basically, the rhymes can be sung in a slow manner, like in a slow paced, and you have to change the pitch of your voice as well. Like, for example, if I sing, Old MacDonald had a farm, yeah. So I'm going to pause, I'm going to wait, I'm going to change my intonation of my voice, my
hmm,
pitch changes. So everything changes. This is going to get that, the child will get attracted to you. Like, oh, someone is
yeah,
singing for me, and the child will start enjoying it.
hmm,
So rhymes are a way that makes the child have fun, and these actually activities can be done while you're bathing the child, while doing activities that the child hates, like
hmm, hmm,
hates them, dislikes them, like brushing hair,
hmm,
taking bath, eating something. So you're like, okay, now it's your turn to eat this. Let's eat. Okay, one, two, and eat. Three. Eating. So you're going to say eating. You're going to say one, two, three. You're going to pause. The child will give you that eye contact, and the child will actually give you a smile and then start eating because he's going to get redirected to you.
hmm, hmm,
Like, oh,
hmm,
someone is singing for me. And every time the child does something nice, you're going to appreciate it. Like, oh, wow, well done, good job. So you're going to appreciate the child every time the child does a desirable behavior, a good thing, you're going to appreciate it. So
hmm.
that's one thing. Second thing is, whenever you're talking to the child, you're going to talk to the child in a slow paced manner.
Okay.
You can't talk to the child at a very fast pace, because if you talk very fast, the child is not able to comprehend what you're talking.
Hmm,
If they can't comprehend, they get confused. So
hmm,
we don't want to confuse them. We want them to take a lot of words in and express them meaningfully later, rather than just repeating the words what we said and just saying it in situations that are not even appropriate for it.
hmm,
So that is one more thing. So that is that. Next is you take the child to, like, you play sand play activities, play-doh activities, like, beads, all different types of activities, and you're going to use self-talk and parallel talk with the child. So self-talk and parallel talk is mainly like activities that, for example, the child is playing, you're going to talk about that activity. For example, the child has a bus, so you say, okay, now we're going to play with the bus. The bus goes beep, 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 beep. So you're going to actually play with the bus with the child and do it like beep, 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 beep. And then you can sing a song, Wheels of the Bus. So you're bombarding the bus word and the beep, beep sound like multiple times. And that's going to help the child understand it.
hmm,
So that's one thing. Then the parallel play is the activity you are doing. For example, you're just cooking food, like mostly mothers or fathers, if they're handling the child and doing lots of other things, they don't get time to specially play with the child. So I'm not saying just keep on playing all day.
hmm,
I'm saying get think of situations where you can actually bombard lots of language. Like, for example, if mom is making chapati roti, or dad is cleaning the house, for example, or doing anything. For example, he's cleaning the couch and the child is sitting and playing with something else, so you tell the child that, okay, now it's time to clean the couch. Okay, so now once you're going to remove all the pillows, like, one, two, come, can you help me please? So the child will come and actually help you, so you can actually do counting like that.
Yeah.
So, and then you can also bombard the word soft, like the pillows are soft, big
Soft.
pillows, like small pillow, all of that. There is one more thing that we can do is, so some parents don't go for it, some parents go for it, and research says that AAC. So in AAC there is sign language.
Okay.
So, sign language is actually, research says that sign language helps the child, encourages the child to think and improves the cognition, and also it speeds up the process of speech development. So
Okay.
there are, so this sign language has lots of, like, I can give examples. Like, for example, if I want to tell the child about a pig, so okay, pig. So this is pig, and then if you say open, so you're going to say open. This is open. Then if you say no, so you're like no. This is no. Then this is yes. So these are different kinds of sign language. Research has been saying that using this with a child as young as, I would say, 1 month old, 2 month old, you
Okay.
can start using that. This is eat.
Hmm.
So these are very simple words that we can use, and this is going to encourage the child to use words as well. So this doesn't say that, if I use a gesture, I'm not going to use a word. No, you're going to use the word along with the gesture.
Mm-hmm.
So this is also one more thing that is coming up, and it's helping the child to communicate as well.
Okay, that's interesting actually to do that at home. So the another question where you said, feeding the child and eating the child. I mean, while feeding the child, you talk and all. But sometimes I have seen children are not able to take the feed properly. They don't swallow it at age of 3 months, or they start drooling. So in that case, what is your experience? How to work with such infant who are not taking the feed properly?
Okay, so I think, so I'm going to answer the question that is related to speech language pathology. There
Hmm.
might be some things that maybe a lactation consultant or a gynecologist can answer well, because
Okay.
that is their domain. So things like swallowing. So yes, speech therapists work on swallowing with the infants. So I would say the child is, first of all, the most important thing is how you support the child while breastfeeding.
Hmm.
So you need to support the child, like, if we know it has to be a little diagonal, close to the breast, and if the child is not able to hold the nipple, we have to support the child a little bit so that he's able to latch on the nipple. Sometimes children are not able to latch on the nipple. So you're going to try doing that, and you're going to actually latch on the nipple in such a way that the nipple is on the tongue.
Hmm.
So the tongue is pressed down. Okay, so when that happens, the child starts sucking in the milk. The tongue is anyways down. So the tongue is depressed. Depressed meaning the tongue goes down. So the milk goes from here, the tongue goes down, and that's how the milk goes in, and then the child swallows. The
Okay.
infant swallows. So yeah, so that's the first step we should do is support the child. We have to give them proper head support, the body support, help them, support them to latch the nipple first, and after that you just support the child to suck it, and then the child will swallow. Now, in case if a child is not able to swallow it, like if you feel that child is just not taking the milk in, so what we do is, we use kind of pacifiers initially. So I have experience working with infants in NICU as well,
Hmm.
wherein due to some or the other birth history, they were not able to swallow. Maybe, like, for example, I saw a child who had a heart surgery, and after that, the child had difficulties in swallowing, and the child was on Riles tube. So what I did is, we actually took like nipple, and we asked the mother to give us some breast milk. We dipped the breast milk we can only give breast milk, by the way, in
Yes.
the initial months. So
Mhm.
we just dipped it on the breast milk and supported the child. We actually put the nipple in and press the tongue. So
Okay.
every time we press the tongue, the child was able to swallow it.
Okay.
So passively, we were encouraging the child to swallow it. So also we took care of the head position also during
Okay.
these things.
Okay.
So I would say if in cases like these, when there are difficulties, try making the child suck the nipple slowly, slowly, use the breast milk, dip it, try to press the tongue, and then support the child a little bit from here, from the lips, and the child will automatically swallow them. Now,
Okay.
this has to be done. Under supervision first. If you feel that child has aspiration or you don't feel comfortable,
Mhm.
you're going to go like meet a speech therapist, or you're going to meet your pediatrician or your doctor, get their clearance, and only then you're going to try it,
Okay.
because we don't want to choke the baby.
Right. Right. Okay.
Yeah.
So now, if my how as a mother, I will understand that my child has a particular sensory needs, or what he's. How will I know that he is craving for certain sensory needs, in terms of
Right.
speech? Yeah, that's
Right.
that's I want to understand. How will I know as a mother?
Right.
I'm a newly mother.
So yeah, so there are so there are very simple things like the child is within 0 to 3 months, and obviously you're going to bathe the infant, you're going to bathe the baby, you're going to feed the baby, you're going to we don't usually brush their hair because it's too early sometimes, so we don't do that, but we just like apply some oil or anything like on their head. We move our hands there. So if you feel that in any of the movements the child is crying or being fussy, or like just continuously keeps on crying, so I would say when you are bathing the baby, the child continues to cry. So I would say that can be one thing that he might have difficulty, like he might have sensory difficulties. um, when you are touching his hair, he might cry.
Mm-hmm.
Again, that's a sign.
Mm-hmm.
Next is when you're rocking the baby,
Mm-hmm.
for example, he's just comfortable with this movement,
Mm-hmm.
okay? And if you're just doing this and the child still cries, he just likes one specific movement and he doesn't like rest of the other movements.
Yeah.
That's again another sign. So these are three signs, I would say, that they might pinpoint that okay, the child might have some sensory difficulties. Also some textures and some sounds, like for example, like there are some musical toys and some toys with lights and all that. As soon as you switch on the toy, the child starts crying. You see that.
Mm-hmm.
So he is not very comfortable with that.
Mm-hmm.
So that is also another sign. Also, clothes. The child doesn't wear full sleeves, half sleeves. Like these days, we get a variety of clothes in
Mm-hmm.
kids. Like everything we have, like
Yeah.
traditional clothes and western clothes and everything. So if for example, if the child is like, okay, just wearing cotton clothes without label or with label, or just full sleeves, just half sleeves, and rest of the clothes he might just pull it off or he might cry. So these are some of the signs, I would say, that these are maybe red flags. So I would say you should consult your doctor, your pediatrician, and also occupational therapists, I would say,
Okay.
because occupational therapists work on
Sensory needs.
infants as early, yeah, sensory needs, yeah.
Okay, but as an expert, do you think we should encourage child to? I mean, just this is question related to your previous answer.
Right.
Like, what if my child is crying for certain sensory needs and he's not liking it? I have seen parents still doing that. Okay, so what would you suggest? They should still continue doing that or should stop doing it because the child is uncomfortable?
I would say the child is more flexible when the child is young, as young as possible. If you train them, if you make them, basically you have to normalize variety of things
Mm-hmm.
with them in
Okay.
day-to-day life. So if you do that in early years, it is going to be easier for you in the future. But if you'll be like, oh, he's crying, I don't want to do this, it's okay, let's just give him the mobile, let's just give him the video,
Yeah.
let's just give him these fries, he's
Hmm.
not eating,
Hmm.
let's just give him that, it's okay. But this is going to affect him in the future. So I would say you should continue to give him variety of situations, different textures, different sounds. Basically, he has to be exposed to variety of things in the environment,
Hmm.
like sand play, play-doh, bubbles, variety of textures like soft, smooth, like crackers kind of sound, very scratchy sound. I
Okay.
think you can wait for like 3, then you just go and see a pediatrician.
Okay. Okay.
Me, Miss Disha?
Yes, yeah, I can hear you now. I can hear you now.
Okay, I think I lost you in between.
Yeah, I felt the same.
Okay,
Anyways, yeah. So go ahead.
yeah, yeah. So, are you able to hear me?
Yes, I can.
Okay, okay. So yeah. So I feel we should expose the child to brushing, bathe, brushing teeth, variety of textures of clothes, variety of sounds, variety of toys. Basically, give him a variety of things to explore. And still, if you feel that okay, there is difficulty, the child is still crying, and you're not able to manage it, you should go and see a doctor, and then go and see an occupational therapist, or you can ask your doctor. He will refer you to the person.
All right. And my last question to you is, you have.
If you just talk to the child, interact with the child, give child chances to speak as well. So these days, some parents, thanks to Google and lots of other resources, they just now they know about the language stimulation, which is really good. They start giving a lot of language stimulation to the children, to infants, and their kids. But sometimes they forget that they have to also give children the chance to also express and revert.
Mhm.
So that is one more thing. Next thing is you shouldn't compare your child with any other child, like, oh, my neighbor's kid is talking this much, oh, my relative's kid is talking this much. No, not like that. Appreciate each and every step, like everything that the child does. Even if,
Mhm.
for example, until yesterday, the child was not sitting on the chair and eating food, he was just, playing around and eating the food. But today, for example, he comes in 2 minutes and he sits on the chair and eats like one bite, one morsel of food. You're going to appreciate the child
Right.
by like, oh, well done, good job, you're going to do that. Do not criticize the child,
Hmm.
um, at all, I would
Hmm.
say.
Okay.
Like
Yeah.
if you criticize the child a
That.
lot, the child is going to have low confidence, and that might create a lot of other complexes in future. And that might, I don't know, it affects his overall personality development of the child then. And I would just say, like, just keep on interacting, playing with kids, give them a lot of um, situations to communicate. And there is nothing like, oh, this is the limit, or this is how, okay, this is normal speech development. No, you just keep on going and going, and encourage them and support them in each and everything that they do, and that is going to excel, like help them excel in future.
Yeah. So, Ms. Disha, thank you so much for this valuable information and your experience that you shared with us. I would just request you to put your email ID in the chat box. So, if people wants to connect to you directly and understand in better, they can do
Yeah.
that. And yeah, all I can say is thank you so much for joining.
Thank you
Thank
so
you so
much
much.
for giving me the chance today. It was a pleasure talking about this topic, which is really close to me.
Definitely.
And yeah, thank you so much.